I think that we really need to have a sea change in attitude more than anything. I think that's, I'm going to try and impart that in my talk, but on the other hand, we thought about using these for chemo prediction. Does chemo work? I do it a different way. What I say is, who are the patients who will do really well with hormone therapy alone? And if you just have that attitudinal change, I think that all of these tests are really trying to measure that. Whether it's measuring a patient who has luminal A breast cancer, or measure a patient who has breast cancer that will do best with anti-hormonal therapy. I think all these tests try to do basically the same thing. And, that's kind of what we're trying to do. And I think just getting away from, how do we know chemo's going to work or not? They don't tell us whether chemo's going to work. That's not the point. The point is these tests tell us a group of patients that does really well with endocrine therapy alone. And I think that's where this is headed. This is headed toward understanding that. And I think the field needs to, what's going to happen is that we're going to use clinical parameters, clinical pathologic parameters, to get 40% of the patients and just say they don't need testing at all. They're going to be fine on hormone therapy alone. Then that other 60, maybe half of those, maybe another 30%, will have a low risk test of whichever test we use. And again, it's hard to know which one to say is going to work, but best. But I think that's where the field's going.